India today recorded 11,109 fresh COVID cases, taking the active infections beyond 49,622. The daily COVID cases is the highest in 236 days, according to the Health Ministry, and the death count climbed with 29 deaths, while 3 deaths were reported from Delhi and Rajasthan, 2 each from Chhattisgarh and Punjab, and 1 from Himachal Pradesh, Karnataka, Kerala, Madhya Pradesh, Maharashtra, Odisha, Puducherry and Tamil Nadu, Uttarakhand and Uttar Pradesh, besides 9 reconciled by Kerala. The data updated at 8 a.m. stated. Now, the new COVID variant Arcturus is behind the surge in cases in India. That's what medical experts are saying, formerly called XBB 1.16. Arcturus is a sub-variant of Omicron that has led to concerns about a fresh wave of infections. However, many experts have maintained there's no need to panic and that people should follow COVID-appropriate behavior and get their booster shots as well. So there's no need to panic. We're now joined by Dr. Vivek Nangia, Principal Director and Head Pulmonology, Max Hospital. Thank you so much, Doctor. And so once again, COVID cases rising and you're back with us, to tell us about this latest surge that we're seeing. It's last 5 days, we've seen consistently the case numbers go up, and now it's over 11,000 cases being reported in the last 24 hours. So far, though, it seems the relief or, something to relieve people's anxiety is the fact that the infection doesn't seem very severe.
So actually, Gargi, the number would be much higher than this, because many people are not even getting themselves tested now. Many are just doing the rapid antigen test at home. So there's only a small number which is reaching the labs where they're getting the RT-PCR done. So only those are being tracked, but probably the number would be double or triple of what is being reported. But the good thing is, as you rightly said, that the infection is very mild. Most people are recovering in 3 to 4 days' time. They're starting with a cough, cold, chest pain, body pain, fever, high-grade fever, which is again lasting only about 3 days. Some of them may be having some nausea, vomiting, loose motions also, but that also lasts only for a day or so. As far as long COVID is concerned, we're still not sure there will be the long-term implications of this. But what we know as of now is that it is not causing much damage. But at the same time, people who are immunocompromised are landing up in the hospital with pneumonia also. So, both the extremes are there. On one hand, there's a mild illness. On the other hand, people who have an immunocompromised status, like those who are elders, those who have comorbidities like diabetes, blood pressure, heart disease, cancers, those who are on long-term steroids, they are landing up with pneumonias also. So precautions are very, very important. COVID-appropriate behavior is something that we have to inculcate and imbibe into ourselves and start following immediately if we are not doing that already.
Right, Doctor. Now, official sources have also said that COVID in India is moving towards being endemic. If you could just explain for our viewers what that is.
So endemic basically means that this virus is here to stay with us and will keep coming and going. So that is why now they don't even call it waves. They only say that, okay, the numbers are going up, the numbers are coming down. So this is inherent into our ecosystem now.
All right. We're also joined by Dr. M.C. Mishra, former director of AIIMS Delhi. Thank you, sir, for joining us. We were just discussing about this latest increase that we're seeing in COVID numbers, but officials and, many medical experts saying there's no need to panic just yet. But yes, do take steps to protect yourself and your families.
Yes, there is no reason for panic, but there is a reason for concern. But we all should be a little bit worried and take measures to prevent this infection happening. Good positives of this spike or surge has been that there has not been, as the Dr. Vivek said, excessive hospitalizations. And this illness at this point of time is milder and also getting resolved quickly over 4 to 5 days. Some people even do not have fever, no body ache, and like that. So I think it's the vaccination, the protection dose is doing its bit for preventing severe infections. But as Dr. Vivek also said, I'll again re-emphasize the elderly and those with comorbidities like diabetes, with pre-existing pulmonary illness, cardiac illness, or for any reason they are on immunosuppressive medication, like for cancer and also for, following organ transplant. These set of people, citizens have to protect themselves. And also I think this brings the point home that those who have not yet taken the protection dose, thinking that COVID is no longer a threat, but as Dr. Vivek said, this viruses now we will experience around the year. Sometimes the infections will happen more, which will be surge. Sometimes they'll be less, as now in winters there are new set of viruses, and when this weather there's a new set of viruses, and May, June, July in rainy season we'll have again new set of viruses, and also mosquito-borne illnesses leading to this fever and illness like which will be actually considered as differential diagnosis for many viral illnesses. So I think the best thing which we can do, what we have been discussing for over 3 years, that protect ourselves, and in hospitals we still apply and put on these masks. But I think general public is tired of preventive measures. I think we should not get tired of it. It's our own protection we should be worried about. So those who have not yet got vaccine, any dose, they should go and get vaccine, whatever protection it will give, and also protection dose, and also take measures to prevent it in the first place, so that we do not have severe illness. One odd person will become serious, that we cannot predict. Nobody can predict which set of people will. So keeping our immunity strong by physical activity, by our dietary measures, I think we should do that and hope for the best. And this surge will, as it has gone up quickly, we are all hoping that it will come down also quickly.
Right. Official sources saying that it's going to go up in the next 10 to 12 days, and then it's going to again start tapering off. We're also joined by Dr. Anita Ramesh, and we're talking about this latest, surge that we're seeing in infections. Over 11,000 cases being reported. As Dr. Nangia said, the number's probably much higher. Not everyone is getting tested, at clinics. But Dr. Ramesh, also tell us, this is a sub-variant of Omicron. So are the vaccines that we have as effective against this infection as well?
See, the vaccines which is made in India by Bharat Biotech and the Serum Institute, it is made against the inactive whole genome of the viron. So they did not do part. So that most probably will take care of most of the variants with this infection. So that way Indian-made vaccine are really robust, and they are very highly effective. We had the same discussion in the last wave also, thinking that whether the same vaccine will work. But it did act. It gave us a 98% recovery rate. And I'm also optimistic and positive about it, since it was an inactive whole viral genome made vaccine. It will be affected against these mutated variants or differentiated genomic variants of the Omicron, whatever it is. Yes, that holds good, but it doesn't stop us from the research. This, again, the new variety, we saw the H3N2, we saw the XBB 1.16. They all, again, need genomic sequencing to know what is the sequence and what is the difference, because we don't know where we are going to. And suppose this becomes more dominant, we may need a different vaccine. So parallelly, research, testing, genomic analysis should run in the lab as we protect ourselves and continue with the same vaccine, which will definitely give us protection as of today.
And is there anything different in this particular infections? Are there different symptoms? There's some reports that people are, developing pink eye. Have you heard anything on those fronts? Because those are, again, reports right now.
Yeah, Gargi, see, being a medical oncologist, I see lots of immunocompromised patients, starting from advanced cancer with uncontrolled diabetes, hypertension, pulmonary, lung mets, pleural effusion, anything you say, we see. Okay, so I have many patients admitted under me with H3N2 positive, with recent subvariant Omicron positive. Yes, a lot of different, first word is that they are not very sick. None of my patients have died. None of them have gone to ICU. None of them had a high oxygen requirement, but then different types of spectrum. One is cough, persistent cough, which persists up to 3 weeks, is very much seen. It's basically an upper respiratory tract of viral infection. It did not involve the lung parenchyma. Skin rashes, diarrhea, vomiting, these type of different symptoms, and what you mentioned also were seen in some of my patients. But overall picture tells you assurance, detect properly, isolate, treat the symptomatic, basically treatment. We did start antiviral therapy for most of them, and none of them, as I told you, no ICU, no oxygen, no mortality so far. Relatively all got discharged, but I keep seeing patients because all of my patients are immunocompromised.
All right. And Dr. Nange, anything you'd like to add here about, what sort of symptoms this time around? And also you spoke about the after effects of COVID and long COVID. That is something that we still don't seem to know enough about. So it is, even if this infection is mild, the illness is mild, that remains a worry.
Exactly. So that is why I keep reiterating every time that it's very important to follow the COVID appropriate behavior. And more important than that is that the day anybody develops symptoms, it's very important for that individual to isolate himself or herself immediately. The moment somebody develops a sore throat, cough, maybe even a low-grade fever, first thing they should do is isolate themselves and get themselves tested. Rather than going around from lab to lab, going from doctor to doctor, and exposing the entire crowd, exposing the entire family, their colleagues at work. It is very important to isolate yourselves first and get yourselves tested so that you're able to prevent the spread of disease to others, especially the immunocompromised ones, those who are more vulnerable to developing complications. And of course, whenever you're going to overcrowded places, they must be wearing masks. Whenever they are, hand sanitization is very, very important. Maintaining social distance is very important to prevent the spread of this disease. That's the only way we can conquer it. The antivirals are available, but in most cases, we're not having to use them at all. Most of the patients are recovering on their own. There's a very small subsegment of patients where you're actually requiring the high-end medicines. But in most others, they're recovering on their own. So while we don't need to worry about it, but at the same time, we need to follow all the precautions to prevent the spread of this disease.
All right. Well, thank you so much, doctors, for joining us and, sharing your experiences and also your comments on this latest surge, this latest increase in COVID cases that we're seeing in the country. Thank you.